One of the most misunderstood chronic health conditions is mental illness. Most people living with mental illness have abundant lives and manage very well, but there are times when a person's mental illness may intensify and affect the way they act toward themselves and others. These are times when you'll need to provide special care and extra attention. That's why we're offering this training program about mental health for older adults. My name is Renee, and I'll be your host for this 3-episode series where we'll explain what mental illness is and share basic skills you can use when caring for adults who may be experiencing a mental health crisis. Each episode comes with checklists and other materials to print out and use in your daily work. To get started, let's first focus on mental illness basics. Once you have a general understanding about mental illness, you'll find it will be a lot easier to connect and care for a person managing a mental illness.
It's important to have knowledge about mental illness because so much is misunderstood. There's a certain stigma around mental illnesses, and it's helpful for people to have some understanding so that they're not afraid and so that they can be more effective if they're a caregiver in helping people navigate and be successful in managing the symptoms of their mental illness.
Mental illness is pretty common. 1 in 5 adults live with a mental illness in any 1 year. 1 in 5 youth live with a mental illness in any 1 year. In our lifetime, about 50% of us will develop some signs and symptoms sometime in our lifetime. But like most illnesses, they have ebbs and flows to them. And you may have one incidence and never have another, but that would be counted in that 50% statistic in our lifetime.
About 1 in 5 adults lives with mental illness in any given year. Poor physical health can lead to increased risk of mental health problems, and poor mental health can harm your physical health. Mental illness is more than just being sad. It covers a wide range of behaviors, from ones that affect a person's mood to those that affect thinking and actions.
So everybody has mental health challenges. We all live with different types of symptoms on a lower level. People with mental illness struggle more significantly. Their challenges impact their daily living to the point that they need some intervention in order to enjoy their lives fully.
We don't know the exact cause of mental illness.
The theory right now is you're born with a predisposition, something puts it in motion. A lot of things could put it in motion. Could be environment, i.e. less sunlight in Minnesota, so SAD disorder. I.e. The fact that you have a baby and you could have some hormonal changes as a result of that, so that's biological, and you could develop postpartum depression.
A key message to remember: mental illness is not a normal part of aging. Society views aging as a time of loss and decline. We assume older adulthood is a depressing or anxious time when we begin to lose spouses and friends, retire from once all-consuming careers, and experience physical limitations brought on by stroke, heart disease, or arthritis. We might say to ourselves, who wouldn't be depressed when our vision worsens and we're walking with a cane? These are false assumptions and only serve to continue the discrimination society has toward both aging and mental illness.
Some of the misconceptions about mental illness are that it's not treatable, that there's nothing you can do, that it's a hopeless situation. In fact, many people don't get properly diagnosed and therefore don't seek care. Most people who seek care, up to 80% of people actually recover from their mental illness as a result of making those changes. Additionally, there's a lot of stigma out there, so people feel shameful to admit that they have a condition that they don't know what to do about.
Here's a few facts about mental illness that you probably don't know. Illnesses like depression, anxiety, bipolar disorder, and schizophrenia are usually developed earlier in life, and many people age with them.
By age 14, 50% of people who are going to have signs and symptoms anytime in their lifetime of a mental illness have them by age 14. That figure rises to 75% by age 24. So it's a young person's onset. Certainly after age 24, that still leaves 25% of people who might develop something after that. But by and large, young person onset.
The intensity of symptoms may vary throughout life. And many people living with mental illnesses work, raise families, and volunteer in their communities to help others. There's hope for treatment at any age. And there's hope for a better quality of life at any age. Mental illnesses are treatable, and people living with them can enjoy healthier, more enjoyable lives no matter their age. Did you know 80% of older adults diagnosed with depression get better when they get treatment? With average life expectancy now around 80 years old, we should be asking, who wouldn't want to get treatment? There's still a lot of time for a better quality of life and to enjoy friends and family.
If you could feel better for 2 more years, this grip maybe of depression that you're experiencing, but some of that could lift and you could have 2, pretty good feeling years. Wouldn't you want to get help for that? So that part needs to be instilled.
So what is mental illness? Mental illness affects our thinking, feeling, and emotions. Mental illness makes it hard to function in our daily activities and to maintain relationships with others. There are several types of mental illness, and many people may live with more than one. We'll focus on the most common ones you're likely to see. Anxiety is the most common mental illness. The first line of treatment is a combination of medications and talk therapy. People with anxiety usually appear overly nervous, restless, or tense. They may talk about a sense of impending danger, panic, or doom. Increased heart rate, rapid breathing, sweating, or trembling can be signs of anxiety.
Anxiety is a really challenging thing, and if you or I think about anxiety, and you think about a time when I was most anxious, perhaps it was public speaking, perhaps it was an athletic performance, or it was a test that I had to take. And I think about the level of anxiety that I would have, and it has a rational explanation. I know why I'm anxious, and I know that when I'm done with the test or with the athletic event or the public speaking, that anxiety is going to go away. And with someone who really struggles with anxiety, there may be an event that's creating some anxiety, but the level of anxiety is way disproportionate to what the event is. It might not be rational, and the anxiety may come and go without kind of a rational reason for it.
Depression is also very common, and the first line of treatment combines medications, known as antidepressants, with talk therapy in either an individual or group setting. Depression symptoms affect every aspect of life: energy levels, eating, sleeping, and interest in work, hobbies, and relationships.
Perhaps it's that their daughter wants to take them for lunch and they're not interested in going to lunch, and they've always looked forward to their daughter going to lunch. Perhaps it's energy to do things that one generally does every day, like take care of your hygiene, take a shower, wash your hair, get ready for the day, brush your teeth. There's not energy to do those kinds of things. There's excessive time spent in bed. There's just this general feeling that I don't have any energy and I'm tired all the time and I want to be in bed. That'd be an example of people struggling with symptoms of depression.
When it comes to older adults, a recent study from the American Journal of Geriatric Psychiatry found that 27% of older adults assessed by trained providers met the criteria for major depression. Are you listening when someone says they're depressed? Most of us think of depression as deep sadness or grief. And that's what we might describe to a doctor or nurse when we're concerned about a person we're caring for. But many people living with depression rarely say they're sad. Instead, they may complain about physical problems like headaches, body pain, or feeling tired. Physical complaints, in fact, are often a common warning sign medical providers use to help diagnose older adult depression. So don't disregard complaints about aches and pains. Instead, make sure the person you're caring for gets a depression screening. Depression screening is a short list of questions that providers use to diagnose depression. We have a depression screening questionnaire you can download for your use. Be sure you work with a trained medical provider when using any depression screening tool. Another common mental illness is substance abuse disorder. Substance use disorders are caused when a person develops an unhealthy dependency on alcohol, prescription opioid and anxiety medications, heroin, or stimulants like methamphetamine. Treatment might include a number of options, including withdrawal management, overseen by an addiction medicine doctor, talk therapy, group residential treatment, and support from peers in recovery. People with a mental illness called bipolar disorder can have big swings in their behavior. They may be up one day with what we call mania and low another day with depression. Most people living with bipolar disorder rarely experience rapid up and down cycles between mania and depression. What's more likely is having long periods of depression with only occasional manic behavior. Treatment usually includes medication and therapy sessions. Personality disorders are another type of mental illness. A personality disorder is a mental illness in which a person has rigid and unhealthy thinking, functioning, and behaving. Persons living with personality disorders are usually not physically aggressive, but their words and actions are often quite upsetting and make it difficult for them to maintain jobs, friends, or healthy living conditions. Personality disorders are harder to treat because medications are not as effective as they are for illnesses such as anxiety, depression, and substance use disorder.
One personality disorder that can be challenging to work with would be someone who has a dependent personality disorder, where they really want other people to do things for them, that they're really looking for other people to help them in many ways with things that they're quite capable of doing themselves. But they're really reaching out and are feeling like they're not capable of accomplishing anything, and they want you to do it for them.
The two personality disorders you're likely to see are obsessive compulsive disorder and borderline personality disorder. A common obsessive compulsive disorder is hoarding. You've watched enough news reports to know what it is. When a person's possessions pose a risk to their life or their safety or their families and neighbors, you need to notify the experts.
One of the things you may find as a caregiver that's difficult to deal with is the person who hoards things. And it's challenging because the person attaches special meaning to everything that they've collected, that to the caregiver, it doesn't seem to be based on any rational thing. There's a receipt for lunch from 5 years ago, yet to the individual, that's the last time they had lunch with Jim, and they're keeping it. And if it were only the receipt for Jim, it wouldn't be a problem, but it's hundreds of receipts, and it's papers, and it's books, and it becomes too much. And I think that one of the effective ways, or one of the ways you can work with that, is to communicate to the person that you think that it's important, that they have a space that feels good to them, that's healthy for them to be in, and that's attractive for them to have a guest into.
A person living with a borderline personality disorder may develop an intense attachment to someone only to abruptly end it over a perceived slight or disagreement.
People with borderline personality disorder tend to make relationships, but then the relationships don't last. And they can be characterized by conflict. And sometimes people who have this diagnosis really struggle to have healthy relationships. And in my experience, they feel comfortable with conflict in a way that you as a caregiver may not. And they may look for things in your personality that push your buttons, that make you feel uncomfortable, and that may make you feel like you want to strike back.
Schizophrenia is an illness where a person has a break from reality and may have visual or auditory hallucinations. Schizophrenia is very rare, and most cases are detected between the ages of 16 and 30. Caregivers may see a higher rate of schizophrenia in their facility because many persons living with this illness require supervised living and support.
With an illness like schizophrenia or schizoaffective disorder, it's more likely that someone's got interfering thoughts and behaviors or irrational ideas. Maybe that they're ideas that are paranoid. Maybe they're ideas that are more grandiose. Typically, you've got interfering thoughts and behaviors with schizophrenia that make it more difficult for someone to concentrate. And there's negative symptoms that go with that as well, that affect mood, that would interfere with someone taking care of things that they really need to take care of, like getting up, getting out of bed, taking care of their belongings, going to appointments, going to work. There's a set of symptoms that go with it that interfere with their ability to do that.
Mental health providers have recently placed post-traumatic stress disorder, or PTSD, as a separate mental illness. PTSD can happen in people who have experienced a shocking, scary, or dangerous event. This includes war veterans, children, and people who have been through sexual abuse or natural disasters. The main treatments for PTSD are medications and talk therapy. Everyone is different, so a treatment that works for one person may not work for another. Ask your supervisor or family member if someone you care for has been diagnosed with PTSD. Is it mental illness or something else? It's easy to mistake certain symptoms as signs of mental illness. That's why a good medical exam is always necessary. The medical exam can help confirm or rule out mental illness as the cause for a person's actions or symptoms.
So I think you should get into the doctor. And I don't mean to a psychiatrist, I mean just get into a doctor. Because think about all the things that cause you not to sleep the same as you used to sleep. There could be, I don't know, millions of things. Let's say that you have a change in appearance and you're an older adult and you're worried because all of a sudden your immaculately groomed grandmother all of a sudden now is spotting, is not going in for their hair appointment. It could be that they have some vision problems developing and they don't even know they have spotting because they have some macular degeneration. So if you get them in, let the professionals figure out what's the problem, and it may not be what you think it is, i.e. I think grandma has mental health problems. Could be some physical issue. If you have an underactive thyroid, that can look like major depression.
Some symptoms that may be caused by medical issues include combative behavior, such as hitting or inappropriate sexual behavior, may be the result of brain damage caused by an accident or stroke. Low energy and poor appetite could be caused by various thyroid conditions or cancer. Delirium is a medical condition with symptoms of confusion, hallucinations, depression, and anxiety. It usually comes on suddenly and can be caused by certain medications, by an infection, or a complication from surgery.
So delirium is an acute disorder of attention and cognition. It's very serious. It's a very common complication of the hospitalized elderly people. Adverse outcomes associated with delirium as increased morbidity and mortality. They are more likely to stay longer in the hospital. They are more likely to fall. They are more likely to develop pressure ulcers. And in looking at the cost of it in yearly, the burden in the United States economy is close to $164 billion.
Older adults can also be more susceptible to medication side effects that impair emotions and ability to walk and speak well. It's about the illness, not you. There's no doubt you can become frustrated by the actions and unkind words when a person's mental illness symptoms flare up. You're human. But remind yourself, the person's actions are caused by an illness and not by meanness. Guard against using derogatory labels when talking with colleagues and friends. The words you use to define others can affect the way you respond and relate to them.
Communication really is the most important thing in working with people who have mental health conditions. It is so important to be a good listener, number one, as the primary communication skill, because getting to know another person means you have to listen to what they're trying to say to you, and you need to be good at understanding not just their words, but their patterns, their behaviors, what they're trying to communicate to you. So you have to be very aware as well. One of the key things about communication that we teach is really being clear about what you try and say, asking questions as opposed to jumping to assumptions or conclusions, not taking things personally. Just because someone says something doesn't mean it's about you. Really, working with the person should be about them. And also just do your best. Everybody's at a different level, and that is okay. If we're all doing our best every day to communicate well, that will definitely improve our ability to work with people living with mental illness.
How can you work best with persons living with mental illnesses? When conflict is the major issue, don't let yourself be pulled into the situation. Take a big breath, Speak in a calm voice and ask other staff to help if you become frustrated or angry. When caring for a person making repeated and unrealistic requests, the best way to respond is by setting limits. Explain to the person with constant demands that you will speak to them and help at scheduled times throughout the day. Also, try to identify the underlying unmet need that is triggering the call for attention.
Well, I think it's important to remember that mental illness is not a normal part of aging. And so we need to remember to treat people like people and understand that when people are struggling, there's certain things we can do that would be most helpful for them. One is have a non-judgmental point of view towards a person and keep respectful and professional in terms of engaging with a person struggling with mental illness. Their symptoms are not about you. Their symptoms are about something they're struggling with, and you can help them with that. One of the ways is make sure that you reach out to others for assistance, be it their family, be it other team members, or a mental health professional who have more experience and understand a person and can help you come up with interventions that will be most successful. Most of all, remember, the person is at the center, so their care is about what works for them. And so you'll need to have a really good relationship and understanding of them in order to have the best interventions that will work for that person.
I think whether you speak the same language or not, is your presence and building that trusting relationship with the patient makes a big difference.
Now, let's review what we have learned and how to apply it in your daily work. Here is your action checklist. Depression, anxiety, and other mental illnesses are not a normal part of aging. Understand the signs and symptoms of the most common mental illnesses. Many people have more than one illness, like depression and anxiety together. Make sure older adults get access to treatment. 80% of older adults who get treatment for depression get better. Ask your medical professionals to screen for mental illness whenever they see your residents. Remind yourself and your coworkers the odd or aggressive actions you deal with are caused by an illness. It's not about you. Try to determine the unmet need that might be triggering the call for attention. Actions and symptoms you believe are signs of a mental illness may actually be caused by brain injuries due to stroke or from medication side effects.
Sometimes a patient is agitated. We think the patient is agitated, but is the patient really agitated or are they restless?
Report any changes you notice to your supervisor or a doctor. Let them know if the person you're caring for is sleeping more, eating less, or becoming withdrawn from daily activities. These could be early signs of a treatable mental illness. With a good grasp of the basics, you can now move to the next session about preventing and de-escalating mental health emergencies. Be sure to download the resources that come with this episode to learn more about mental illness. This video is funded by Stratus Health, Building Healthier Communities.